What's up, guys? My name is Dr. Webb. I'm an orthopedic spine surgeon here in San Antonio, Texas, and today you guys are going to be hanging out with me for a day in the life of a spine surgeon. Let's get it! All right, so it's about 9:30 in the morning. It's not a typical day for me as a spine surgeon, but last night we had some late cases. I didn't finish my surgeries until like 10 p.m. Got home about 11:30, got into bed around 12, woke up at 4:30. And then back at it again this morning. I had to go around and see patients, which means in the hospital, see my surgical patients, see how they were doing, try to discharge them if possible. And we had a board meeting also kind of following that. The board meeting is essentially when we, as partners, I'm a partner in my private practice, we get together and discuss kind of some strategic plans for our group and practice. So now we're heading to the airport. I have a flight to catch, which leaves or boards in about an hour or so, hour and a half. We're heading to Charleston, South Carolina. I was invited to speak to a group of surgeons at a roundtable event about social media and practice building, and also just getting together and discuss some surgical cases, spine-related cases. So it should be a good trip. We're going to head to the airport and then head to Charleston, South Carolina. Just got to the airport. I got like 12 minutes before I have to jump on a Zoom call. I'm actually talking to some high school students that want to go into the medical field. And these students have all read my book, and just meeting with them to answer some questions. So. Yeah, that's a great question. So each step along this process, you're going to have to modify the way you study, the way you approach certain subjects and concepts in classes. So what works for one class in college may not work for the next class, or what works in college may not work for medical school and residency and fellowship. So a lot of repetition. You have to be very disciplined and organized. I spent 8 years in the military, and that's where I got that rigid structure from. My day is very organized. I know exactly what I'm going to accomplish for the day. I know exactly what needs to be done. I have a schedule that I follow. I knew this was at 10:15 a.m. I was in surgery last night until 10:30 p.m. I got home around 12 midnight. I woke up at 4:30. I went to the hospital at 6 a.m. I went to a meeting at 8 to 9:30, and I drove to the airport. And I have you guys, and I'm about to jump on the flight. Like, I enjoy going to work. I love going to work because I love operating and I love surgery, and but it is hard to stay motivated. You have to find some balance also, things outside of medicine that interest you, and those things kind of keep you motivated and keep you pushing along. All right, so we just got done speaking to the high school students that are interested in medicine. Those students read my book and they reached out to see if I would speak to the students this morning. They had a lot of great questions about the path to medicine and also to becoming a doctor. So yeah, we're about to go board the flight now and head to South Carolina. All right, so we just got to Charleston, South Carolina. I'm about to head to the hotel now, and this evening we have a dinner event to discuss some topics in spine surgery. There are about 25 spine surgeons that will be here at this meeting, and should be a good meeting. So we're going to head to the hotel now. guys, so just got done with the conference this evening. Great lecture by one of my former staff from fellowship who talked about A-lifts, or anterior lumbar antibody fusions, when we fuse the patient's spine from the front, and also disc replacements from the front. So that kind of concludes our evening. Tomorrow we have a really long day. We're doing a cadaver lab. We're having some lectures. I'll be giving a lecture about social media and spine surgery, and looking forward to it. So I'm gonna get some rest. Catch you guys tomorrow. So I just got my scrubs on. We're about to head to the lab and get started here. I'll be giving a lecture today, so I have a thumb drive with my PowerPoint talking about basically social media and spine surgery. So we're gonna go get started here soon. How many people are on social media professionally? Oh, that's a good amount. Okay. Social media is not for everyone. It does require some time commitment, and some people may not feel comfortable just doing things online. But these are the three things that I think are most important. You have to be searchable. When patients are searching for back pain, neck pain, some condition in spine surgery, people have to search for you and be able to find you. The second thing is you have to be marketable. And the third thing is, especially for young surgeons who are the first 2 years out of practice, 50% of people leave their first job. You have to have something that's transferable. So a lot of surgeons, they go to a practice and then they leave. Well, they don't have a website or a content that they can take to their next practice. Well, I think that's important. If I leave my group right now, I can take all of my information with me to my next practice and just notify all my patients on social media. It's like, hey, this is where I'm going. Everybody's aware. So. So we just got done with my lecture. I'm about to put on some surgical gear and head into the cadaver lab. We're looking and exploring, learning about various approaches to the spine. There are a couple surgeons here that are world experts in this, and just trying to learn. So. All right, guys, so I just got back in town last night, had a great trip, but I wanted to say thank you guys for watching this video. We have a lot of great content coming out soon. Make sure you subscribe, and we'll see you soon.